From budget presentation to universal health coverage, this time the Lagos State government has again reassured residents of providing equitable access to quality health care through the EKOSHA Health Alliance initiative of the State Health Management Agency. This was echoed at the EKOSHA fundraising event held at the Ebony Life Place in Victoria Island, Lagos.
The Lagos State Health Management Agency has continued to take charge of its responsibility by ensuring that residents take advantage of the Lera Eco Health Insurance Package to receive subsidized healthcare services. The EKOSHA Community Initiative, designed for the vulnerable residents in a bid to enhance universal health coverage, has impacted thousands of lives in the state. The EcoSocial Health Alliance has equipped children with skills and knowledge, and the secretary to the state government assures people of more investment in the health sector.
We promised you to ensure better livability for all. To demonstrate our commitment to the development of the health sector, our further commitment, and making health service accessible to the people of Lagos State, we have invested in the infrastructural development of our public health facilities. We have continuously done this to quite a number of our facilities, and these have been remodeled and upgraded, while plans are underway to build additional primary health centers.
The chairman of LASHMA commends donor partners for supporting the scheme since inception.
EcoSocial Health Alliance, EKOSHA, is an innovative resource mobilization arm of the LASHMA agency, which was established to augment the government support for the vulnerable among us and the indigent residents towards achieving a universal health coverage. EKOSHA was conceived based on the Lagos State Health Scheme law, which was to define or devise any alternative means for funding healthcare insurance. Permit me at this point to use the opportunity to thank the LASHMA board and the management led by Permanent Secretary Manuela Zamba for their good work, and to encourage them to continue to strive for a total coverage of universal health coverage for indigents and all Lagosians.
In sustaining the initiative, the State Health Management Agency is raising additional funds to provide equitable access to quality healthcare services at affordable rates. The State Commissioner for Health, Professor Akin Abayomi, and other senior health officials encourage more people to key into the state health insurance scheme for their own benefit.
So one of the most important things is health care. So this equity fund in the state budget is allocated to buying insurance, health insurance for Lagosian citizens who are resident in Lagos and qualify. We are able to identify them because we have a database to measure people who fall below the threshold of self-sustainability. And that database is what we use to access people and pay for their health insurance so that they can access health at any of our government facilities, our primary healthcare facilities, our general hospitals, or even if they choose to go to a private facility. So that we have in place to make sure that we create a social safety net for vulnerable members of society that at least they can get a basic healthcare package, which is what they require in terms of hypertension, diabetes, fever, birth control, antenatal care, immunization, nutrition. Those and even simple and basic surgical procedures will be available to our citizens free of charge because it is paid for by government in the form of a health insurance, and they can use that insurance to access health.
Currently we have about 923,000 people covered under Lera Eco in Lagos State. About a third of that, which is like 334,000, are the vulnerable that we have been able to cover thus far. That's using the equity fund, which Mr. Governor Babajide Sanwo-Olu gives to the agency, as well as the basic healthcare provision fund from the federal government, and then support from philanthropists and general members of the public. This event was set aside for us to be able to raise funds to cover an additional 200 to 300,000 people moving forward.
It's a fundraiser raising event so that we can get enough money to be able to pay for their own access to healthcare. You never know when something is going to hit you. You never know when the child is going to need care. But right now, what Mr. Governor wants to do, and I think it's also from federal, is that every single citizen in Nigeria will have coverage, healthcare coverage. And this is us in Lagos saying everybody living in Lagos will have health coverage. That means they'll get access to quality care, they can afford it, and they have access. And don't forget, they are vulnerable. Children are vulnerable, the elderly are vulnerable, the handicapped are vulnerable. So this is for them to get it free. And to get it free, we need help from individuals, from organizations, banks, to support LASHMA, EKOSHA, that's the social aspect of it, to support us so that we support them.
Over 900,000 residents are registered under the Lagos State Health Insurance Scheme, and more people are encouraged to get on board to reduce out-of-pocket expenses.